Welcome back, guys. Now, first let's see what exactly is this JG apparatus. Later we'll be discussing about how this JG apparatus helps in the autoregulation of the GFR. Now, this JG apparatus is made up of three types of cells. What are they? Guys, for easy understanding purpose, now I am showing you afferent arteriole here. Okay, usually I show afferent arteriole on this side, right? Now, for easy understanding purpose, I am showing you afferent arteriole. So, this is the side which is bringing the blood to the glomerulus. Now, on the afferent arteriole, see, there are these modified smooth muscle cells which I am showing in the green color. So, these modified smooth muscle cells in the green color, they are called as the JG cells. So, right here, my dear students, what are these cells which I am showing in the green color? These are JG cells. JG stands for what? Juxtaglomerular. See, you know, this is the area of the glomerulus. Just side to the glomerulus, there are these JG cells, juxtaglomerular cells, and you guys are experts that these JG cells are the one which produces renin. They produce renin. Now, here on this tubule, so what is this part of the tubule? This is the ascending limb of loop of Henle, you know, thick ascending limb of loop of Henle, and here this is the distal convoluted tubule. In the junction between thick ascending limb of loop of Henle, thick part of ascending limb of loop of Henle, and the distal convoluted tubule, in this junction area, exactly in this junction, there are these black color cells present, which are the chemoreceptor cells. They are always checking what is happening in the urine. So, these black color cells, which always check the sodium chloride levels in the urine. So, these cells are called as, these black color cells, favorite cells for the exam, these are called as macula densa. They are called as what? Macula densa, which are always checking the sodium chloride levels in the urine. Now, tell me, these cells are sitting together, the JG cells and macula densa are coming together. Now, in between these two cells, there are also some useless cells present. There are also cells, okay, in the pink color which I am showing here, these cells, we exactly don't know what is their function. These cells are called as extraglomerular, okay, extraglomerular mesangial cells, extraglomerular mesangial cells. So, all these three cells together called as what? All these three cells together called as JG apparatus, juxtaglomerular apparatus. So, these are like making a girlfriend and boyfriend sitting together, the JG cells sitting near to the macula densa, okay. In between them, some useless ferros are also there. Who are they? These extraglomerular mesangial cells. So, all these three cells together called as what? JG apparatus. Now, right. So, this JG apparatus is made up of first JG cells, also called as granular cells. Okay. What are they? They are modified smooth muscle cells on afferent arteriole. They are the modified smooth muscle cells on afferent arteriole. Okay. The next cells are macula densa. So, where exactly these macula densa cells are present? Macula densa cells are present on thick part of ascending limb of loop of Henle. Is a better answer, guys, when compared to distal convoluted tubule. Okay, distal convoluted tubule. So, actually these macula densa cells are present in between, in the junction of the thick ascending limb of loop of Henle and distal convoluted tubule, but you have to pick one. If you have to pick one best answer, the thick part of ascending limb of loop of Henle is the best answer, okay, when compared to DCT. If you don't have the thick part of ascending limb of loop of Henle, you can mark distal convoluted tubule as the best answer. Next, in between these two cells, some useless cells are also sitting. No, they are called as extraglomerular mesangial cells, also called as Lassus cells. Okay, Lassus cells, also called as Polkissin cells. Okay, so these are just the different names. How the question was recently asked in the exam? The question was something like this. See, they gave this histology image and they have asked, by looking at this histology image, everyone is clear. Everyone knows this. This is the glomerulus. Here is the glomerulus. This is the Bowman's capsule. Everyone knows here is the this is the Bowman's capsule, and here will be the glomerular capillaries. These are the glomerular capillaries. And what is this structure over here? This structure which I am showing over here, this is the distal convoluted tubule. This is the DCT, distal convoluted tubule, and you know on the DCT, in the junction of a thick part of ascending limb of loop of Henle and DCT, there will be macula densa. Okay. Now, what I am trying to say, look at this diagram. Guys, look, now you will have a understanding. See, what is this? This is the Bowman's capsule. See, here is the Bowman's capsule. What do you see here? These are the glomerular capillaries. So here will be the glomerular capillaries. These are the glomerular capillaries. So here will be the place where filtration will occur. So this is the place where filtration will occur. Now you get the nephron. Guys, here I am showing you. Here is the Bowman's capsule. If this is the Bowman's capsule, there will be proximal convoluted tubule, right? See, here is the proximal convoluted tubule. This is the proximal convoluted tubule, continuing as descending limb of loop of Henle, and later ascending limb of loop of Henle, and thick part of ascending limb of loop of Henle. Now you tell me what is the orientation? See, the distal convoluted tubule. See, this area which I am highlighting right now. So this is the distal convoluted tubule, right? So the distal convoluted tubule, it is coming very close proximity. The distal convoluted tubule is in very close proximity to what? Bowman's capsule. So yes, this is the DCT, and here is the Bowman's capsule. So now that's what exactly I am showing here. So look here, this is the Bowman's capsule, and what is this tubule? This is the distal convoluted tubule. Just side to it, there is distal convoluted tubule, and you guys are experts on the distal convoluted tubule. Which cells will be there? Macula densa cells. Of course, I have told you that macula densa cells are mainly present on the thick part of ascending limb of loop of Henle, and they are also extending towards the DCT. But you have to pick one. If you have to pick one, pick thick part of ascending limb of loop of Henle. So now here these cells which I am showing little highlighted color, little dark, what are they? They are macula densa. They are the macula densa. So in the recent exam they have asked, okay, this is the DCT. So what are these cells that I am highlighting? What are these specialized cells which I am highlighting over here? So these are macula densa cells. Okay, these are the macula densa cells. Okay, done. And here who will be there? Guys, here there will be extraglomerular mesangial cells in between the macula densa and the JG cells. There will be extraglomerular mesangial cells, and here, okay, here somewhere over here there will be the JG cells will be present. Okay, so there will be JG cells, extraglomerular mesangial cells, which are hard to find, but you can very clearly see this area which I am highlighting. These are the cells of macula densa. Okay, these are the cells of macula densa. Again, I am highlighting this area. This area is the cells of these are the macula densa cells. Done. So that's the histology image which was recently asked as an image based question. Okay, image based question. Done. Next step. What is the function of this JG apparatus? What exactly it is doing? JG apparatus tries to help in autoregulation of GFR. Okay, helps in the autoregulation of GFR. Now, what is this concept of autoregulation of GFR? Means always the GFR should be in the range of 125 ml per minute. Okay, 125 ml per minute. There is a range, but round figure I am taking. Always how much should be the GFR? Always it should be in the range of 125. Doesn't matter whatever is happening in the body. Always the GFR should be 125. For example, tell me, what if my patient is having more GFR? Is it good or bad? Bad. Less amount of GFR is bad, as well as more amount of GFR is bad. Whenever there is too much amount of GFR, that can actually cause a damage to the nephrons. That causes the kidney injury. Okay, so that's called as a hyperfiltration injury, guys. So now tell me what my patient is having. My patient is having more GFR. Good or bad? Definitely bad. Let me draw it here for you. So here is the glomerular capillary, and here I am showing you the nephron. So here is the nephron. Today what happened? Today there is more GFR. Okay, more GFR is happening. Definitely bad, sir. Whenever there is more GFR, what do you think will happen to the sodium chloride? More sodium chloride is filtered or less sodium chloride filtered? So today there is more sodium chloride filtered, more amount of sodium chloride filtered. Now more sodium chloride is going to reach to the distal convoluted tubule. So now there is more amount of this sodium chloride is reaching the DCT. Yes or no? Yes. Now on the DCT we are having the specialized cells. What are the specialized cells, guys? These are the macula densa cells. Now the macula densa will sense, okay, today there is more sodium chloride in the urine. Now macula densa will understand, okay, today there is more sodium chloride in the urine, which means the GFR is more. So what I am trying to say, macula densa, by sensing the urinary sodium chloride levels, it can estimate the GFR. It can understand the GFR. So now what the macula densa is doing? Look, the day you are having more GFR, look, more sodium chloride is filtered, more sodium chloride is going towards the macula densa. Now macula densa cells will start to release adenosine. Macula densa releasing adenosine. Now this adenosine, what it will do? It will cause afferent arteriolar vasoconstriction. Afferent arteriole will undergo vasoconstriction. So you tell me, When the afferent arteriole undergoes vasoconstriction, have I taught you? Just go back, look at here. When the afferent arteriole is undergoing vasoconstriction, what will happen to the GFR? Decreases. Adenosine causes afferent arterial vasoconstriction, so GFR decreases. So problem solved or not? So the day you are having more GFR, macula densa, it is trying to bring the GFR back to normal, decreasing the GFR back to normal. Okay, good thing. Next, in the same way, when your GFR is less sodium chloride will be filtered. Now less sodium chloride is going towards the macula densa. Now macula densa will understand, okay, today there is less sodium chloride in the urine. It is always checking the urine sodium chloride levels. Okay, so macula densa today it is finding, okay, today there is less sodium chloride, so GFR might be less. Now do you know what the macula densa will do? Macula densa, it will activate the JG cells. Okay, it is activating JG cells. Now what our JG cells will release? Renin. RAS pathway is activated. RAS pathway produces angiotensin 2. Now what the angiotensin 2 will do? I have told you, angiotensin 2 acts on, angiotensin 2 acts on efferent arteriole, causes constriction of efferent arteriole. But the constriction here in this condition will be mild constriction only. Okay, not too much, just mild constriction, not too much, just mild constriction of efferent arteriole. So now you tell me, whenever there is mild constriction of the efferent arteriole, there will be increase in GFR. Have I taught you previously? Look, when the efferent arteriole is constricted, see when the efferent arteriole is constricted, here the pressures will increase, the hydrostatic pressure will increase. So what will happen to GFR? Increases. It's not a severe constriction. Whenever there is a severe constriction, initially GFR increases, later it can go down. But now it is just mild constriction, guys. Whenever there is a mild constriction, GFR will be kept elevated. It will be kept elevated. So tell me, whenever the patient is having low GFR, problem solved or not? Whenever the patient is having low GFR, the macula densa is trying to increase the GFR. Okay. So what I'm trying to say, finally, when the patient is having high GFR, macula densa decrease the GFR. When the patient is having low GFR, macula densa can increase the GFR. Means trying to maintain the GFR always at normal levels. So this is called as tubuloglomerular feedback. Okay, tubuloglomerular feedback. Now, why it is called as a tubuloglomerular feedback, sir? Because see, the one who is sitting on the tubule, the macula densa. See, I am the macula densa. Let's say where I am sitting. I am sitting on the tubule, renal tubule. That's a nephron. It is giving the feedbacks to the glomerulus. Increase the GFR, decrease the GFR. It is giving the commands. So it's giving the feedback to the glomerulus either to increase the GFR or it can decrease the GFR. So that's why this macula densa is giving what? Tubuloglomerular feedback. And what is the importance of the tubuloglomerular feedback? Is regulation of. Okay, regulation of what? GFR. Done. So with this, autoregulation of GFR topic, most of the topic completed. Now let's see what the two MCQs. Direct MCQ, tubuloglomerular feedback is given by which cell? Macula densa. I have taught you, macula densa is mainly present where? Thick part of ascending limb of loop of Henle is a better answer when compared to DCT. Okay. Next, macula densa, it is sensitive to which levels in the urine? It is sensitive to both sodium as well as chloride. It is sensitive to both sodium chloride levels. By checking the sodium chloride levels, it can estimate the GFR and it can change the GFR. So always remember. So what is the mechanism by which there is autoregulation of GFR? The mechanism number 1 is tubuloglomerular feedback with the help of macula densa. Tubuloglomerular feedback with the help of macula densa and adenosine. This is the number 1 mechanism which I have explained you. But there is also one more mechanism, a small mechanism called as myogenic mechanism. Myogenic hypothesis, or you can say myogenic mechanism. So what is this myogenic hypothesis or myogenic mechanism? See, what does it mean by the word myo? Myo means muscles. So some muscles are also trying to maintain your GFR, auto-regulate the GFR. What are these muscles? Let me tell you. Guys, look at this diagram. Here I am showing you afferent arteriole, let's say. Let me show in the red color. Let's say here is your afferent arteriole. Here are the glomerular capillaries and here efferent arteriole. Okay, here efferent arteriole. Now, today, let's say my patient is having more BP, more blood pressure. Okay, my patient is a hypertensive patient. You know, most of the, half of the people in India are hypertensive patients. Okay. Now, whenever there is more pressure in our blood vessels, there is more pressure in our blood vessels. So here also there is more pressure, more blood pressure. So whenever there is more pressure, automatically what can happen to the GFR? The GFR can go up, which is bad for the kidneys. Yes or no? Whenever there is more GFR, that is bad, okay, for the kidneys. So now, whenever there is more BP, the GFR can go up. But I am asking you, is it good? Definitely not. It's definitely not good for the kidneys. So what happens? Whenever there is more blood pressure, that high blood pressure, do you know what it will do? See, here on the afferent arteriole, there are these muscles. This is a muscle. This is a smooth muscle, afferent arteriole or smooth muscles. This high blood pressure, whenever there is more pressure here, that high blood pressure is going to open, okay, because of that high pressure. Whenever the more the pressure increases, the more the pressure, they will open this calcium channel. Because of this pressure, they will stretch open the calcium channels. Okay, so these are stretch sensitive or the pressure sensitive calcium channels, let's say. Now, what will happen? Now there is movement of calcium into the smooth muscles. Okay, this extracellular calcium, now this extracellular calcium is going to the muscles. And you all know, whenever there is more blood pressure, more the channels will open, more calcium will go. Now, what the calcium is doing? This calcium is helping in contraction. The calcium is helping in what? Contraction of the smooth muscle. So now you tell me, so today what happened to this afferent arteriole? Now the afferent arteriole gets constricted. Okay, now the afferent arteriole is getting constricted. When the afferent arteriole is getting constricted, narrowed down, when this afferent arteriole is getting constricted, so what do you think will happen to the GFR? Now tell me, do you think the GFR can still be high? No, the GFR, now it will come to normal, okay. So even though the patient is having high BP, his GFR will be still kept at normal levels. It will be still kept at normal levels. Understood? So what I am trying to say, so these muscles can also regulate your GFR. Which muscles? The afferent arteriole or smooth muscles. With the help of which channels? Calcium channels. So these calcium channels, okay, cause the smooth muscles to contract, causing the afferent arterioles to constrict. So trying to maintain the GFR. So doesn't matter whatever is your BP. So your BP, even though your BP fluctuates, your GFR will not fluctuate. Okay, always there is some mechanism happening in your kidney, that is the tubuloglomerular feedback and this myogenic mechanism. Both will always try to maintain your GFR at normal range. So tell me, the second mechanism, myogenic mechanism, is with the help of which channels? This question was asked. Myogenic mechanism is with the help of calcium channels. And tubuloglomerular feedback is with the help of macula densa. Okay, macula densa, or you can say adenosine. Okay, macula densa releases adenosine, right? So with this successfully what we have completed the topic of autoregulation of GFR, and histology image also very important, don't forget. So this is the distal convoluted tubule. On the distal convoluted tubule, what are these cells? These are the macula densa cells which are always checking the sodium chloride levels. Okay guys, the topic of JG apparatus and autoregulation of the GFR with the two mechanisms called as the tubuloglomerular feedback and myogenic hypothesis done and dusted. See you in the next video. Thank you.